I'd recommend everybody to attend. So just like I love to go and hear the psychologists, the physicians, the nurses, because I'm thinking about their issues from my perspective on what I can do. The same applies from them coming to hear what nurses do, because we're all working together as a team.
Why should you attend the Epilepsy Nursing Section talks at the International Epilepsy Congress? Well, because there are some fabulous people speaking, including inspiring epilepsy nurses, plus even a few patients from around the world. We should be educating, learning from, and inspiring one another on how to provide the best care possible for people affected by the epilepsies. Today, we hear from two of the most globally influential, lovely epilepsy nurses, Patty and Ludivine, who will be leading the pack in Lisbon. If you haven't done so already, please do like and comment on this episode and subscribe to our channel so that we can get way more people learning facts about the epilepsies. We have the International Epilepsy Conference coming up in Lisbon in a few weeks, like it's really not that long. And us lot, amongst a few other people, will be working together to talk about epilepsy nursing. So Ludivine, what will your role be?
In the International Congress, I will be the chair of the IEC Nursing Symposium, which is a symposium for nurses, where you will have some nurses talking about promoting education and self-management. So we will have some nurses from all over the world.
And what about you, Patty? What's your role in all of this?
So we have another session that we're going to be addressing some of the emotional and behavioral aspects of epilepsy. And from the nursing perspective, what is it that we need to know? And then how nurses might manage that, whether it's in the community setting in Africa, we have a nurse from Africa talking, or in an epilepsy monitoring unit where some of the unique issues or changes in mood or behavior come out when you're triggering off seizures, lowering medications.
I mean, I can say from personal experience is that mood, behaviour, seizure activity, and a million other things are so interlinked. So we can't just look at one thing at one time.
Oh, absolutely correct. You know, anything our brain can do normally, it can do abnormally when we're having seizures or when we're influenced by medicines or other therapies. And some of the more common areas of where seizures arise are the ones involved with mood and behavior.
Yep.
So when you're having seizures, that's going to be different, or even the way we think and remember things. So we have Dr. Gus Baker that's going to be talking about that whole biology of mood and behavior and how seizures are influenced it, but then also how the psychosocial factors or stigma might play into it. And so that'll set the stage for addressing some of the nursing challenges.
So Ludivine, tell us, what are a couple of the things that we're going to be talking about?
In this session, it will be divided into two parts. So in the first part, we will have some people with epilepsy and caregivers who will talk us about their experiences in epilepsy and what are their needs and how nurses can help. So we will have, by example, a nurse from France who is in charge of a program to enhance the attachment bonds with the child when in the first years of life. These childs are West syndrome. Yes, so it's not easy for us to create this attachment
for the benefit of the child and the parents. In
the second part, we will talk about safety. We will have a focus on SUDEP because I think it's a very important topic, and we will have also a topic on physical exercise.
I think it's called to talk about physical exercise because much of the time we'll talk about neurological activity and mental health, which of course are crucial. But again, as we were talking about before, Patty, everything's interlinked, right? So I think physical activity and health is really important too.
Well, one of the things about the exercise is that so often healthcare professionals might tell the person with epilepsy or family to restrict activities, you know, because you worry about the danger of if they have a seizure. But, you know, when properly done with supervision, safety equipment, whatever, there aren't that many activities that are totally off bounds, but how you should do it might vary. Climbing mountains alone might not be a good idea, but physical exercise itself is critical. And there's that role of how can that help not only our brain, but can that help decrease seizures if one's doing better, in their overall health? Or is there any direct effect? So we'll hear a touch of that.
Sleep quality affects mood, right? Which affects seizures, and exercise, affects sleep, which affects the mood. It's all just in one great big thing, isn't it?
Big circle. If any one part of that circle, is messed up, everything else goes, I think.
So tell us about the next bit then, Patty. What will we be talking about?
So one of our goals is to get nurses around the world comfortable in, presenting some of their own work, because there's so much good work being done by nurses, but many times it seems like that's invisible. So we're having what we call these networking sessions in the exhibit hall where nurses from around the world have been able to, submit their ideas, and they'll have 10 minutes to present and 5 minutes of discussion to hear all this unique stuff that's being done around the world. And in addition to learning what they're doing, it's developing that next generation of nurses to kind of elevate their skills, their leadership, to kind of keep this whole nursing network going.
And would you recommend for people other than the nurses to attend our talks?
Oh, I'd recommend everybody to attend. So just like I love to go and hear the psychologists, the physicians, the nurses, because I'm thinking about their issues from my perspective on what I can do. The same applies from them coming to hear what nurses do, because we're all working together as a team, ideally towards the same end.
The same end being quality of life, and however one would achieve that. And I think that you do that the best through multidisciplinary teams, right? And working as one, as cheesy as it sounds.
And sometimes we might address some of the topics that you don't necessarily hear in just you don't hear in a basic science platform or as all physicians. So it's a lot of good give and take that you can have.
Could you both give us an example of the type of things you hear about that you don't think patients and families usually bring up with their neurologist?
Well, embarrassing things is not necessarily, it doesn't have to be embarrassing, but can I have sex? What do I use for contraception? That's some of the same things. And what happens if I have a seizure when I'm having sex? My husband doesn't want to touch me anymore because he's afraid of doing that.
Ludivine, what do you think of that often comes up, especially I suppose with people with DEE and intellectual disability? What are embarrassing things that could come up?
Embarrassing things, it's embarrassing. It's about constipation and food and some troubles like that. And physicians don't ask this question. They ask about the food, but not the I don't know the word in English.
Not the digestion and how it comes out the
transit.
Other end.
I don't know.
I like that. The transit. Yes.
Is it a good one?
Yeah.
Perfect. I like it.
Ah, yeah. Okay.
It's not the word. It's not the word, is it, Patty? But I think it's a cool word to use.
Because we are the specialists of this sort of problems, and we can give some advice.
Well, it's a real common thing, because you think about it, is that if your activity is restricted for whatever reason, having seizures, socially you don't go out as much, you end up getting more constipated. You don't really want to go. Medicine side effects. But our gut is intimately tied into our brain. And there are parts of the brain where our seizures are coming from that influence how things move through your GI tract.
And also, I've done an episode on this ages ago. We were talking about digestion and constipation, and how constipation can actually affect absorption rate of medication. Right? It makes perfect sense when you say that. So it's just another reason to think about the corners and things that, and the travel of one's food. And yeah.
I think one of the things that we can do as nurses is that before we actually try, teaching people with epilepsy or families what their issues are, ask them to write down or bring forth what are the top 3 issues that they have. you know? And then that's where we might hear about some of these things. Their GI tract's not moving right. They're worried about sex. They're worried about dying, you know, or how do I take care of my kid? And then that can help us uncover those tough topics.
Yeah, and I think another one would be, and you guys, I know, hear about this a lot, is the social aspect of when having an epilepsy. How do you talk to the outside world about it? Things like employment. How do you, becoming educated about your own disease is a real big issue, I think, for lots of people.
From my perspective, one of the big things is either not knowing how to talk about it or being afraid that whoever they're talking to is going to think that they're different, that they're not going to understand the epilepsy. They're crazy, they're different, and not want to hang out with them, you know? So it's that fear of losing friends for fear of what they're going to think. And then what happens when I have a seizure in public. So those are tough things.
And I think epilepsy nurses play a key role in that, in building the confidence of the individual, but also of the family. And I think if you build the confidence of the family too, that hopefully they'll be a little bit less overprotective and be able to balance what you do and what you don't do better, would you say?
That's the problem in the education. Sometimes the people with epilepsy is not the one who is more affected by the seizure. Sometimes it's the family and the parents, and you must educate them to...
But not be too overprotective?
Yes, too overprotected, yes.
This isn't all going to be depressing. It's going to be, I think, an empowering session. We might even have a little bit of a giggle. Have you got any sort of... any other things to say about why people should attend?
For me, this conference, it's a big way to showcase the nurses, because the nurses are very important and they are often too discreet, I think. So to see some nurses talking about their actions and to see how they can help people with epilepsy, I think it's really, really important to go and see that.
The other thing is that the International Congress gives nurses and all healthcare professionals and parents and people with epilepsy who are there a chance to see all the exciting things happening in epilepsy, you know? And so you see as some of the advances are, new things that you might not hear about, and you hear about it from all different perspectives. And then you can take that home and think about it. That can influence our practices in so many ways. So there's so much going to be going on there.
Thank you to Patty and Ludivine for giving us a snippet of what shall be going on at and why people should attend the nursing section talks at the IEC in Lisbon. Check out more about Patty and Ludivine and their international work on the website torierobinson.com, where you can access this podcast, the video and the transcription of the entire episode all in one place. Please do like and comment on this episode and subscribe to our channel so that we can get way more people around the world learning facts about the epilepsies. See you next week.